regards to healthcare, the only healthcare provider that we have in Erie County is actually our Wesley nurse. We have an EMS, but that's not healthcare, that's emergency services. And we have a volunteer fire department that sometimes gets called out, and they again are not healthcare providers, they are emergency services. And so sometimes those individuals end up being stopgap measures for care. Then those individuals who have been attended to by our services have to then begin the process of trying to figure out what needs to happen next. Teresa is an excellent resource in that when someone comes to see her, she has the capacity to pick up the phone and call a doctor or Esperanza Clinic or something like that, West Texas Counseling, and say, I have a client that we need to make an appointment for. Can we get them in? And that she provides as the first step. But then the other thing that happens is to navigate that healthcare system. What happens next? Where do I go? What do I do? What is resolution to whatever my healthcare need is at this moment in time? And so sometimes she's able to help navigate that and help to advocate for that person when they don't have any advocate. I think that it's needed not only in Mertzon but everywhere, as Texas, I think it is by 2020, will have about 41 million people that will suffer from type 2 diabetes. And so diabetes and type 2 diabetes, not only in the state of Texas but in our nation, is on the rise as obesity rises. And so any healthcare education that can be provided for exercise, diet, what to look for as far as signs of diabetes, maybe what to look for as far as signs of hypertension that can be associated with obesity and those sorts of things, diabetes and heart disease. So I think that education is very important for our community, especially those who are limited in their resources, either economically or coverage from Medicaid, Medicare, or something else, private insurance. They are less likely to go in for preventative care, and it becomes a critical necessity at some point, and then it's maybe beyond just education, but now they have to develop some sort of treatment process. And if education was part of this process, those signs and symptoms can be identified very much earlier in the process, and maybe through corrective action of diet and exercise can reduce that risk so that they don't end up being on medication or become an emergency situation where hospitalization or potential surgery be a resolution. Healthcare in Mertzon means to me that we have either a facility or a staff, one or many, that can provide adequate healthcare to our community. And it can be from someone who knows how to apply a Band-Aid to someone who can figure out how to maybe stitch up a cut or a wound, or to adequately assess an injury to be able to help that person who comes in for care to be taken care of. In 2014, 2015, Erie County gave away $100,000 in scholarships. Local donations only. So they are very much vested into the future of this particular county. Because it has been primarily a county that has been tied to the land, either through agriculture, ranching, or farming, much of that is kind of funneled in that direction. I think if kids thought about the possibility of doing something related to healthcare and that promotion, that they would begin to foster that type of idea, that type of possibility that there are other things that I might be able to do that would still put me into the community that I was raised in, and then they could give back, because that is very much a ideology of this community, and that is many of the kids that have gone on to ASU or to other universities and entities of higher education do come back and begin to participate and take part into the community. But again, it is primarily from an agricultural standpoint. And so if there was another avenue that could still put them back in this area, I think that they would take advantage of that. Some of the strengths are the way that the community is tied to one another, that they so invest in our kids. The community thrives on the students and the kids of this area. I mean, heart and soul is poured into our kiddos because they want them to excel in whatever they want to do. And they want to do whatever it's going to take to make that happen. So that's something. And then I think that there is a I don't want to call it pride, but there is a definite desire that this community continues on, that it doesn't be and won't be a community that just dries up as a result of maybe the oil industry's fluctuation, that they would just somehow dissolve back into the dirt which they grew up out of. I mean, Mertzon is a crazy place. I mean, we have a banker that does third world economics. We got PhD people from UT and Texas State and that live here, a hydrogeologist, a land management development person. We just have an amazing kind of eclectic collection of individuals that add spice and character and depth to our community, and really want to see it continue on into the future. So it has sort of that frontier mentality of what caused people to come out here and settle out here, and whose families have been out here for 150, close to 200 years, yet the progressive ideology that we need to invest in our future in order for our future to continue.